Hi physio students, as you've probably figured out by now, mean arterial pressure, or MAP, is a very important physiological variable. MAP is important because it represents the pressure gradient driving blood flow through the entire systemic circuit. Keeping MAP around 85 millimeters of mercury is essential for maintaining adequate blood supply to all of our organs. The baroreceptor reflex is an extremely important homeostatic regulatory mechanism that functions to make sure MAP never drops too low. Most responses in the baroreceptor reflex are carried out by the sympathetic division of the autonomic nervous system. When we look at the equation for mean arterial pressure, we see the three variables that MAP depends on: heart rate, stroke volume, and total peripheral resistance. The sympathetic division is able to raise MAP in four ways by acting on various effectors to change each of these three variables. The first effector organ is the heart, where there are two distinct responses. First, the sympathetic division acts on pacemaker cells in the heart to increase the rate of spontaneous depolarization, increasing the heart rate. Second, the sympathetic division innervates the cardiac contractile cells in the atria and the ventricles to increase the force of the heart's contractions. This increases stroke volume. Do you remember which adrenergic receptor mediates the sympathetic effects in the heart? Yep, beta-1 receptors bind both norepinephrine and epinephrine in the heart to promote these first two responses. The third response occurs in the smooth muscle of veins. The sympathetic division acts via alpha-1 receptors to promote depolarization and an increase in cytosolic calcium levels, enhancing smooth muscle contraction. This increases venomotor tone, which reduces venous compliance and increases venous pressure. This promotes the return of blood to the heart, increasing the end diastolic volume and finally the stroke volume. Lastly, the sympathetic division also promotes vasoconstriction in arterioles. This is the main way to increase total peripheral resistance, or TPR. Remember that the adrenergic receptor found here in arteriolar smooth muscle is also alpha-1 adrenergic receptors, which promote depolarization and increase cytosolic calcium levels to enhance smooth muscle contraction. So now we've seen all four ways the sympathetic division acts on various effectors throughout the body to increase MAP in the baroreceptor reflex. This is all important clinically because patients who are in shock can be given norepinephrine to help raise mean arterial pressure by promoting all four of these responses in the body to hopefully prevent organ damage and death.